Hello and welcome. You're watching CNN News 18 Digital Live. This is the Health Bulletin. Did you know that cervical cancer is the second leading cause of cancer deaths in India, and about 60,000 women die of it every year? Even then, there is no awareness as far as vaccine for it is concerned, HPV vaccine. In fact, it's not even a part of India's immunization program. Today, India has launched its first gender neutral HPV vaccine. And to talk more about it, I have with me Rehan Khan. He's the managing director of MSD India, the company that has launched the vaccine. Welcome, Rehan. If I can talk to you everything about the HPV vaccine, who needs it, who doesn't need it, why do we need that? But to start with, we start with the basic. What is the HPV vaccine, Rehan?
Thank you for inviting me. The HPV vaccine is a vaccine that protects young women, young girls, and young boys, in this case, Gardasil 9 vaccine, against the human papillomavirus, which is linked to cervical cancer and a number of other types of cancers, for example, anal cancer, vulvar cancer, etc. So this is a vaccine, which is a 9-valent vaccine, 9 serotypes, very broad protection. And this vaccine is for young girls between the ages of 9 and 18, young women between the ages of 18 to 26, and young boys between the ages of 9 and 15.
It's interesting. Could you also explain why is there a gap as far as the age for male and female is concerned?
The studies that we've done basically have been for this age range. There are, studies in other markets that have been done, which we haven't registered in India, which are for a broader population. But for now, we're launching with this population in mind. The most interesting thing is that this is the first ever gender-neutral vaccine in our country. Therefore, both boys and girls can be protected from this significant disease. And I think, as you're aware, some of your audience may be aware as well, there are roughly 170,000 cases of HPV in India. This is just the ones that are tracked, that are diagnosed. About 100,000 of those are cervical cancer, and 60,000 deaths every year with cervical cancer, which is completely preventable with this vaccine. So if I can just summarize, every 9 minutes, one of our citizens, one woman, loses her life to cervical cancer every day in India.
That's a disturbing figure, Rehan, to say the least. But when you look at the reality on the ground, as far as the HPV vaccine is concerned, it's still not a part of the immunization program as far as India is concerned. Now, is MSD looking at any sort of partnership with the government so that the vaccine can reach more and more people, especially in rural areas?
Absolutely. If you look at the NIP, National Immunization Program, in other countries, the Gardasil NIP program is in over 45 countries. The overall HPV NIP is in 100 countries. So absolutely. In our country, we've done some work with Punjab and with Sikkim. Both of those places we've worked with the state governments. And absolutely, going forward, we will certainly work with many more state governments in partnerships to expand availability of vaccination.
That's interesting. But also, if I could ask you about the cost of the vaccine. What can you tell us a little bit about it, so that the viewers also get an idea about who can afford it, who cannot afford it?
Absolutely. I think the cost is being decided as we speak, so I can talk to you about that separately. But what I can tell you is, look, this is preventative vaccine, it's preventative health. And if we look at our country, we have 600 million people in our country below the ages of 25. That's roughly twice the size of the US population, roughly 3 times the size of Brazil. And we have roughly 230 million people between the ages of 10 and 24 years of age. So from an impact point of view, from a prevention point of view, this is significant. Better to wear the seatbelt well before you begin the journey than after the accident. So this can make a significant impact in the lives and health of our young population and the future of India.
Also, vaccine hesitancy has been a part of not just India's history, but for any new vaccine, there's always a bit of hesitancy which creeps in. Uh, does the vaccine, the gender neutral HPV vaccine, is any sort of side effects that you would like to mention for our viewers?
So, you know, one must always talk to the doctor. There's no significant side effects that I can talk about, but one must talk to their doctor about anything specific. And you know, if I look at this, you know, what we've just seen happen in our country is just a tremendous example, probably the best example in the world of a government driving significant vaccination programs. No other government in the world has driven the kind of programs that we have driven as a country today. You know, roughly 10 million vaccinations a day. So there used to be some vaccination hesitancy. Hopefully, more people have realized that taking vaccines of this type, HPV vaccine, Gardasil, can make a big impact in their lives and the lives of their families going forward.
Now, many don't know why men, or boys rather, need an HPV vaccine. And since you've launched the first gender neutral vaccine, for the benefit of our viewers, could you explain what is the reason that boys also must take the HPV vaccine?
Well, boys can contract HPV as well, just like girls. And boys can have anal cancer, they can have penile cancer, they can have genital warts. This vaccine protects against many of those diseases. What is interesting is that out of the 9 serotypes that this vaccine covers, in India, 98% of cervical cancer is related to those 9 serotypes. The rest of the world is about 90%. So it's a very relevant vaccine for India, and certainly, this is exactly why both boys and girls this is relevant. And also, I should mention, for young adult women between the ages of 18 to 26 years of age, who can make that decision to go out and get vaccinated. Today it's a 3-dose vaccine, so at 0 months, 2 months, and then 6 months. In some countries, this vaccine exists in 2 doses, and certainly that's something we'll look at in the future in India as well.
Also, how does the vaccine work? What's the mechanism behind it?
I mean, we can get into scientific details separately, but it's basically it's a well-tested vaccine with multiple trials, and I can take you through some of the trials and things that have happened in the vaccine. But essentially, from an efficacy point of view, it's a very efficacious vaccine. And the other interesting piece is that it's being tested. Gardasil overall has had nearly 3 million doses around the world. So it's been tested very, very broadly. Our previous product, Gardasil 4, is available in 160 countries. Gardasil 9, the product we're launching right now, is available in 72 countries. It's registered in nearly 80 countries. So very broadly tested with millions and millions of patients.
Also, what you told us, who should be taking the vaccine, the age groups. Is anything suggestive from the trials of who shouldn't be taking the vaccine?
Nothing I can share with you right now. I mean, what first thing for any vaccine, any product like this, one must talk to one's doctor. That's most important. Second, there is an age range in which this vaccine should be taken. And any healthy patient, any healthy consumer can take this vaccine.
Also, from an awareness point of view, are you in talks with the government? Is there any plan, so to say, to also reach out to masses and tell them about this vaccine? Because I can tell you from a point of view of a reporter who's covered health for a while now, that as far as the vaccine is concerned, there's very limited awareness on the ground. Many don't know that a vaccine like this even exists.
You're absolutely right. I mean, the largest challenge in our country, when you look at the large population of young people in our country, very few people may be aware that a vaccine exists to prevent HPV and prevent cervical cancer. And one of our jobs is to make sure that all of our doctors that prescribe this product are aware. That's the first thing. At the same time, from a disease area perspective, not a brand perspective, we want to make sure that many future patients, consumers, are aware and they make the right decision. I think the best thing for them to do is, if they're aware of this and they find out about it, is go talk to the doctor.
And now the World Health Organization also has a massive and ambitious, um, you know, a program that they wish to eradicate cervical cancer. Uh, where do you see it from an India standpoint?
Has recommended uses of HPV vaccine, has mandated it across multiple countries. In our country, yet it's not part of the NIP, but hopefully it will be. Certainly, as I've mentioned to you before, we will have multiple conversations with multiple state governments for this to be included. In any conversations we've had in advance with the government has been very, very positive to the discussion.
Also, when you say this is the first gender-neutral HPV vaccine, how does it stand different from the other HPV vaccines that are available?
So the other vaccine that I can talk about, which is our vaccine, that's only for women. It was not for boys. And this is the first vaccine where boys are included in the roster. The second piece is that I think all parents should look at getting boys vaccinated. This message, like you said, I don't think this message is out with consumers and patients. And one of our jobs would be to make sure we engage, future patients in this awareness of this disease. Again, like I said, I think the best thing is for patients to go and consumers to go talk to doctors, because doctors will be able to educate them about the need for it and about the various dosages and things like that.
All right. Also, Rehan, I wanted to talk a little bit about the possible side effects, if there are any. Because that sort of gives more confidence to people to go and get the vaccine. It gives confidence to more parents, for example, to go and get their children that vaccine, because only till and up to a certain age for men and women, for boys and girls, can you take this vaccine?
Absolutely. Look, I'm not a qualified doctor, so I can't talk about side effects, and many of these are very specific to the person in consideration. So the best thing to do is to go talk to your doctor. And if you have a question about it, the doctor will be able to update you. So if a person, for example, has a specific need, for example, if they're immunocompromised or they're pregnant or something of that kind, then best to go talk to the physician. It's very hard to give a very general view of side effects. But this, like I said, this vaccine has been administered to millions and millions of people all over the world.
All right, thank you so much. Thank you so much, Rehan Khan, for joining us. You heard him. This is a very, very crucial vaccine. Not yet a part of India's immunization program. Hopefully soon. That really is the hope, because this can, in fact, prevent a lot of deaths. And as I pointed out in the beginning, around 60,000 women die of cervical cancer every single year, and of course other cancers as well. And this is something which is preventable. There's a vaccine for it now. There's a gender neutral vaccine available for both boys and girls. So the hope is that there could be more done as far as the awareness for it is concerned. And yes, hopefully India will look into it and soon incorporate the HPV vaccine in their immunization program. Thank you so much, Rehan Khan, for speaking to the Annual Meeting.
Thank you for inviting me.